Hello. My name is Jones, and today we are looking at a surgical condition known as acute abdomen. Acute abdomen refers to conditions that have a sudden onset and affect the abdomen or abdominal organs and usually require immediate or urgent surgical intervention. Okay, so acute abdomen can also be looked at as an acute intra-abdominal condition of abrupt onset, usually associated with pain due to inflammation, perforation, obstruction, infection, or rupture of abdominal organs, and usually requiring emergency surgical intervention. Okay, so any part of the lower gastrointestinal tract is susceptible to acute inflammation that can be caused by bacteria, viruses, fungi diseases, or trauma. Some of the conditions of acute abdomen may not be diseases but by themselves, but such as intestinal obstruction, is not a disease by itself. But eventually, if one has intestinal obstruction, it may lead to inflammatory processes such as peritonitis, appendicitis, which may then complicate into acute abdomen. So if someone has total obstruction of the intestinal tract, that will be acute abdomen. If someone has partial, it may not be acute abdomen, but it may lead to inflammation within the GIT or gastrointestinal tract. Okay, so if we have peritonitis or appendicitis, then we may have acute abdomen. Most common acute abdomen conditions include appendicitis, ruptured ectopic pregnancy, peritonitis, diverticulitis, small bowel obstruction, large bowel obstruction, strangulated hernia, volvulus, intussusception, or ruptured spleen. Okay, so let us now look at some of the common causes of acute abdomen. So one of the common causes of acute abdomen is inflammation. We can have acute appendicitis where the appendix is inflamed. So when one has an inflamed appendix, there is sudden severe abdominal pain, such that if inflammation continues without treatment, the appendix can rupture. Okay, the other common cause of acute abdomen is that to do with acute diverticulitis. Acute inflammation of the diverticulum just simply means the pouch or pocket of any portion of the gastrointestinal tract. So this commonly occurs in the large intestine. That is where you may have acute diverticulitis. So there will be severe pain and tenderness, usually in the lower left part of the abdomen, or other part or other areas within the abdomen. The patient may feel some severe pain or may feel some pain. Okay, so under inflammation, other common causes of acute abdomen include acute cholecystitis. So acute cholecystitis, we are just looking at acute inflammation of the gallbladder. Okay, under inflammation, other causes of acute abdomen can be acute salpingitis. And when we talk of acute salpingitis, we are looking at inflammation of the fallopian tubes. Okay, so some of the common causes of acute abdomen under inflammation, we can talk of appendicitis, acute diverticulitis, acute cholecystitis, acute salpingitis. Now, we can also look at some of the common causes of acute abdomen to do with the intestinal obstruction. Okay, so intestinal obstruction may be a mechanical obstruction where the blockage could completely stop, or seriously impair the passage of intestinal contents. The part above the obstruction may swell. Okay, it may swell up when fueled with food, fluids, or digestive secretion. So mechanical obstruction is commonly caused by volvulus, and when you say volvulus, this is the twisting of the intestine causing obstruction. So in this case, blood supply is cut off to the affected part, and gangrene may occur if not managed properly. Okay, the other cause of obstruction is intussusception. When we talk about intussusception, we are looking at prolapse of one of the intestine into another part immediately adjacent to that part. Okay, so intestinal obstruction can be non-mechanical, for instance in paralytic areas where the normal contractile movement of intestinal temporarily stops. Okay, so then we can also talk about peritonitis, okay, to do with inflammation, as also one of the causes of acute abdomen. So peritonitis necessarily as a separate condition, as one of the causes, we are looking at inflammation that is caused by an infection or inflammation of the lining of the abdominal cavity. So peritonitis is inflammation within the peritoneum. Usually infection spreads from an infected organ in the abdomen, okay, as a common source. Then peritonitis, as one of the common cause of acute abdomen, may also come due to perforation of the stomach or perforation within the intestine. Okay, so perforation in the stomach, like in perforated peptic ulcers. Okay, so you can have also perforation of the appendix, perforation of gallbladder, that may lead to peritonitis. Okay, so also rupture of fallopian tube or rupture of ectopic pregnancy may lead to peritonitis and eventually leads to acute abdomen. Okay, so now we can look at another cause of acute abdomen, which is ischemia. Ischemia is where there is a deficiency in blood supply, which could be as a result of strangulated hernia. Okay, so when you say strangulated hernia, this is hernia of the bowel in which the neck of the sac containing the bowel is so constricted that the blood supply is impeded, and gangrene may result if not managed promptly. Okay, so other causes in relation to ischemia is volvulus. So the blood supply is cut off and gangrene may result if not managed promptly. Okay, the other cause that may lead to ischemia is torsion of the ovarian cyst. This is where the long pedicles of an ovarian cyst twists, leading to impaired blood supply to the affected parts. So if not treated properly, also this may lead to acute abdomen. Okay, so now let us also look at another cause of acute abdomen to do with ruptured arterial aneurysm. Okay, so ruptured arterial aneurysm is the rupture of an aneurysm. Okay, so when an aneurysm is simply a bulge or dilatation in the wall of an artery. So this is the rupture of an aneurysm, usually the abdominal aortic aneurysm. There is excruciating pain in the lower abdomen and back, also tenderness over the aneurysm. Okay, with severe internal bleeding, a person may rapidly go into shock. Okay, so these are the main causes of these are the main causes or common causes of acute abdomen. So these main causes of acute abdomen can be can be remembered with using a mnemonic HIPPO. HIPPO, that is HIIPO. Okay, so H as one of the common causes of acute abdomen has to do with hemorrhagic conditions within the abdomen or hemorrhage. Okay, then I has to do with inflammatory condition. We talked about acute diverticulitis, peritonitis. Okay, then we can also talk of infarction. Okay, so infarction, the death of some tissue that may lead to peritonitis within the abdomen. So infarction. So these are the classification here. Then P is perforation. Okay, perforated appendix, gallbladder leading to acute abdomen. So this classification helps us to remember the common causes of acute abdomen. Okay, so O is for occlusion. So you can use HIPPO or the HIPPO model as classification for acute abdomen. So under inflammatory, you can mention the many conditions that are there. Okay, so if you don't want to use the HIPPO model to remember the classification and put diseases, you can use the VMINT, okay, when talking about the causes of diseases to do with acute abdomen. Okay, so the VMINT here, V is for vascular causes. Vascular causes may include perforated peptic ulcer, perforated bowel. Okay, so these are to do with the vascular causes. Okay, then M is for mechanical causes of acute abdomen. So when you are talking about mechanical causes, we are looking at obstruction of the intestine by worms, food bolus, volvulus, intussusception, and other conditions that can fall under mechanical as discussed within this lesson. Okay, then I can fall under inflammatory conditions such as peritonitis, appendicitis, okay, acute diverticulitis. All these are inflammatory conditions that may lead to acute abdomen. Okay, so N is neoplasms, like growths that obstruct a movement of food along gastrointestinal tract, or growths that obstruct the intraluminal intestinal passage may lead to acute abdomen. So that is the VMINT. Okay, VMINT, HIPPO. Okay, VMINT and HIPPO model can help you remember the common causes of acute abdomen. Okay, in the HIPPO we have said H is for hemorrhagic conditions, I for inflammatory, I for infarction, P for perforation, O for occlusion. Okay, then the VMINT, vascular conditions, diseases to do with blood vessels, okay, or affecting blood vessels. Okay, if blood vessels do not supply a certain area within the abdomen, it may lead to gangrene. So if let's say there is rupture of an aneurysm, that is a vascular condition. Okay, M is mechanical. Mechanical has to do with all obstruction conditions or conditions that may bring about obstruction, like intestinal worms. Okay, then I in the VMINT is for inflammatory conditions. N is for neoplasms, and then T is for trauma. Okay, trauma or trauma. Okay, so with that discussed, let us look at types of acute abdomen. So on types, there is dynamic. Okay, there is dynamic type, and there is a dynamic or a dynamic type. So dynamic is known as mechanical type, and then a dynamic is known as functional type. So these are the two major types of acute abdomen. So dynamic, in this type there is intraluminal obstruction, which causes an increased peristaltic process that works against the against an obstruction, or it can be neural obstruction from pressure on the intestinal wall. For instance, a bolus of incompletely digested food material. Okay, so to do with a dynamic or mechanical, we can also look at this type coming as a result of solid stool, as in constipation, stenosis, stricture, adhesions, hernia, abscesses. Okay, or this type may come as a result of a gallstone in the wall, or malignant stricture, intussusception, or invagination of the loop, or that is, when I say intussusception, that is invagination of loop of the intestine up on itself. So that is the intussusception. Okay, so the second type of acute abdomen is a dynamic or functional. In this type of intestinal muscular, in this type of acute abdomen, okay, intestinal musculature cannot propel the contents along the bowel due to cessation of peristalsis, and there is no propulsion waves, okay, to push the food to move downwards. So this commonly occurs in paralytic areas, or can be temporal as a result of manipulation of the bowel during surgery. So a dynamic or functional can also be looked at as intestinal obstruction, okay, that may be complete, or it can be incomplete, where there is a partial obstruction that can affect either small or large intestine. So in a dynamic or functional, there's to do with complete or complete obstruction. Here, the severity will depend on the region of the bowel that has been affected, and also the degree to which the lumen is occluded, and especially the degree to which the vascular supply, okay, to the bowel is disturbed for it to culminate into acute abdomen. So these are the two main types of acute abdomen: dynamic and adynamic. Or we can say the other name for dynamic is mechanical. Then the other name for adynamic is functional. Okay, so briefly, preoperatively, we are saying this is an emergency. Okay, it's a surgical emergency. Okay, so all conditions of acute abdomen are surgical emergencies. So on this you need emergency care. Okay, so the management is to do with emergency pre-op. Patient will be new orally, because if patient, let's say, eats, may vomit and aspirate the vomitus under the influence of anesthesia. So you have to insert a nasogastric tube in order to empty the stomach, especially if the patient has eaten within 4 to 6 hours. Okay, if there is blood loss, or if a patient has vomited a lot, causing some kind of circulatory failure or dehydration, okay, so intravenous fluid then will need to be commenced. A fluid balance chart will be used to monitor patient's fluid level or electrolyte level. In case patient is in shock or there is urinary retention which is suspected, a catheter should be put for easy monitoring of fluids. Okay. So blood is also collected for grouping and cross-match. In case a patient loses a lot of blood during surgery, okay, you might need to transfuse. Other things that may be involved in the general care is removing any denture, explaining the procedure. Okay, if at all the surgeon's preference is to have patients shaved, okay, that has to be done. Okay, and then a consent will need to be signed, and then afterwards you have going to give IEC according to the predisposing or the cause of the disease. So remember, early ambulation is important to prevent adhesions. Okay, so If at all you want to have a good glimpse of how to care for the patient preoperatively, we have done a lesson on that and the emergency care that is needed. Okay, so today we are looking at the condition acute abdomen. We have defined acute abdomen as an intra-abdominal condition of abrupt onset, usually associated with pain due to inflammation, perforation, obstruction, or infarction. Okay, and require emergency surgical intervention. We have also given some examples of conditions that constitute acute abdomen. So the conditions that constitute acute abdomen include appendicitis, ruptured ectopic pregnancy, peritonitis, diverticulitis, small bowel obstruction, large bowel obstruction, strangulated hernia, volvulus intussusception, or ruptured spleen. Okay, so we further expanded these the common causes of acute abdomen to do with inflammation, to do with obstruction, to do with peritonitis, ischemia, and also ruptured arterial aneurysm. Okay, then we went on to classify the causes of acute abdomen using the Hippo model. Okay, so under the Hippo model, we are saying the classification includes hemorrhagic. Okay, so acute abdomen coming because of some hemorrhage or bleeding. Okay, then inflammatory. Okay, acute abdomen coming because of inflammation within the abdomen. Occlusive coming because of obstruction. Infarction coming because there is peritonitis or there is some infection within the abdomen. Then perforation. Okay, this is coming because of perforation, like in a ruptured appendix or ruptured spleen. So all these may fall under acute abdomen. So the causes can also be looked at in terms of the VMINT model. So please, these are models that I've just come up with so that you can find it easier to understand the causes of acute abdomen. So VMINT is for vascular causes to do with aneurysm, that is vascular, to do with blood vessels. Okay, then from there, mechanical, to do with obstruction. Then I to do with inflammation, like peritonitis, appendicitis, all those conditions. Then N to do with neoplasms that may cause a blockage. Then T to do with trauma. Okay, so those are the causes of acute abdomen. So we discuss these causes and then we discuss classification, and we are saying to remember classification, you remember Hippo. So the Hippo model gives you the classification and it helps you to know the common conditions under acute abdomen. Then we went on to look at types of acute abdomen. So there is dynamic and adynamic. The other name for dynamic is mechanical. So when you talk of mechanical, is anything that will cause obstruction will fall under dynamic. Then adynamic, this is coming because of failure in peristalsis. Okay, so any condition in which there is failure for peristalsis, that is functioning or functional, then we are to function well, then we are going to look at this as functional or a dynamic type of acute abdomen. So from me, I'm saying thank you and keep studying.